Within Regent Hall family, we have some key workers who are currently working under great pressure on the front line throughout this pandemic. And we're trying to profile them a little bit so that we can hear their stories and know what to pray for on their behalf. Last week we heard from Sian Gaze, and today we're hearing from Charlotte Sharman.
I'm currently working as a practice nurse within the NHS. Traditionally, my work has involved trying to keep people well with screening programmes, disease management, immunisations, and recently my work has changed dramatically due to the pandemic. I am seeing fewer patients at face-to-face appointments, trying to do a lot more work over the telephone where possible, and only really seeing patients for essential treatment if it's deemed urgent. So things like cancer injections or mental health injections that are deemed to be essential. So one of my worries at the moment is about some of the longer term implications of these changes to people's health and well-being. So by putting on hold some of the screening programs and the checks that we normally do, I do worry that there will be an increase in certain diseases and illnesses further down the line. There is some frustration at the moment that I'm not able to carry out my job as normal, and also there are concerns about the frequent changes to people's roles and what they're asked to do, and changes to their way of working. At the moment, I do feel scared when a patient comes into my clinical room. I never have in the past, but due to the pandemic, even when I'm wearing my protective equipment, there is a fear in the back of my mind that this person may have the virus, maybe bringing it into the room unknowingly, and that it could be passed on to myself. So my particular areas of concern right now for all staff working in the NHS, the first one is that staff do feel safe at work, they are given the right equipment, and they do feel that they are being looked after and safe so they can give good patient care, and also that patients will be able to access all the routine screening and long-term condition care that we normally offer them, so that will prevent them becoming ill in the future, because those things are really important, and that we can clear the backlog that will develop so that we can offer those things to patients as soon as it's safe to do so.